In this video, we will talk about colposcopy, a procedure used to examine the cervix. What is colposcopy? Colposcopy is a diagnostic procedure used to examine the cervix, vagina, and vulva. It helps in identifying abnormal areas of the cervix that may require further evaluation and treatment. Purpose of colposcopy: primarily used to follow up for biopsy of cervix if Pap Smear results are abnormal. Indications: following conditions require colposcopy. Abnormal Pap Smear: it shows atypical cells or HPV infection. Visible cervical lesions, observed during a routine pelvic exam. Positive HPV test, especially high-risk HPV types. Unexplained bleeding, postcoital bleeding or irregular menstrual bleeding. History of DES exposure: women exposed to diethylstilbestrol. Preparation for colposcopy: following preparations are required. Timing: scheduled when the patient is not menstruating. Avoidance: patients should avoid intercourse, douching, and use of vaginal medications for 24 to 48 hours before the procedure. Informed consent: explanation of the procedure, potential findings, and any associated risks. Now, let's talk about the procedure. Following are the steps of colposcopy. Colposcopy takes about 10 to 15 minutes. Positioning: patient lies on the examination table, in lithotomy position. Speculum insertion: a cusco speculum is inserted into the vagina, to provide a clear view of the cervix. Examination with colposcope: the colposcope, a specialized microscope, is used to examine the cervix, vagina, and vulva. It is placed at a distance of 20 centimeters from external os of cervix. Observe the cervix. Now, observe the gross view of cervix and look for any sort of abnormal mucosa, or abnormal form of blood vessels. Take a cervical swab of mucosa, and now clean the mucosa with normal saline. Observe the transitional epithelium. Observe the squamous-columnar junction. Normally, upper columnar area appears as red grape-like furrows, and lower squamous area shows homogeneous gray area. Application of solutions: now, the cleaned cervical mucosa will undergo staining. Acetic acid, vinegar, applied to the cervix to highlight abnormal cells, which appear white. This occurs due to precipitation of protein content of abnormal cells. This is also known as aceto-white staining of cells. These are dysplastic cells, can be cancerous or precancerous. Lugolzidine may be used to stain the normal cells, making abnormal areas more noticeable. Biopsy: now, take biopsy of abnormally stained cervical mucosa. Follow up after colposcopy: results from biopsies typically take 1 to 2 weeks. Follow-up depends on the findings. Possible findings of cervical biopsy: normal, no abnormal cells or lesions detected. Cervical enteroepithelial neoplasia could be grade 1, 2, or 3. Cancer can be invasive cervical cancer, or other malignancies. Infections: identifying signs of infections such as HPV, herpes, or other sexually transmitted infections. Importance of colposcopy: early detection, helps in early detection and treatment of cervical cancer, and precancerous conditions. Guiding treatment, provides detailed information to guide appropriate treatment plans. Risks and complications: discomfort and pain, mild during the procedure. Bleeding: light spotting is common, but heavier bleeding may occur after biopsy. Infection: rare but possible.